Hi, Team DHHS. I'm pleased to recognize the recipients of the Autumn 2023 Heart of Excellence Awards. The following recipients have demonstrated our department values of connection, impact, empathy, innovation, equity, accountability, support, and efficacy. So here we go. The award for connection goes to Emily Helm, a caseworker specialist in the Division of Child and Family Services. Emily is a constant source of strength, knowledge, and support for her team members in the American Fork office as a whole. She readily is available to consult on cases and helps her peers, new employees, and supervisor. She's de-escalated emotionally charged workplace situations and has counseled newer caseworkers on how to better handle their caseloads. She listens to them and provides constructive feedback. More importantly, the way she connects with people helps in retaining workers. Congratulations, Emily. Next is the award for impact. We're recognizing Skyler Munson, a clinical therapist in the Division of Correctional Health Services. Skyler is the sole therapist assigned to the Antelope facility, which houses close to 500 of the most violent, dangerous, and unpredictable male inmates. She assesses the mental health of 64 inmates 3 times a week. She responds to crisis calls and arranges for alternative housing to stabilize them if needed. She advocates for her clients to get the appropriate mental health care if their level of need exceeds what's available in Antelope. She also teaches new staff how to work within the corrections system in a way that's beneficial for them and the inmates they work with. She's a vital member to the mental health team. Thank you, Skyler. The award for empathy goes to Nadya Ugarte, a program specialist in the Division for Services of People with Disabilities. Nadya has helped establish essential and needed services for around 2,500 individuals with disabilities and their families. She's helped DSPD translate dozens of documents so the families they serve can be better informed of essential information. One of Nadya's most compelling character traits is that of empathy for those she works with. Of the hundreds of people she has had on her caseload, her supervisor can't remember one dissatisfied person. DSPD has received numerous emails from mothers, fathers, siblings, and family members praising Nadya's help, patience, and fortitude. Thank you, Nadya. Next, the award for innovation goes to a team member in the new employee category. Sam Andersen is a COVID-19 contact tracer with the Division of Population Health. From the beginning of his employment with DHHS, Sam established himself as a stellar and trustworthy employee. Sam has helped innovate and improve in the following ways. He proposed and then aided in the development of a community health worker connection pathway, which has helped connect members of our community to rapid assistance. He was a significant contributor to a multi-jurisdiction analysis of COVID-19 transmission, which was later published in the MMWR. He asks thoughtful questions and finds innovative solutions for complex projects that involve many partners and stakeholders. So congratulations, Sam. The award for equity goes to Heather Sarin, a health program specialist in the Division of Population Health. Heather leads several interdisciplinary and cross-cultural work groups and fosters connection by drawing on our common goals and values and cultivating personal relationships with everyone she oversees. Heather's dedication to health equity is inspiring. In particular, she's also overseen the development of maternal resources for Latina, Pacific Islander, and rural communities, as well as for people who use substances. She recently led a discussion about birth trauma, particularly that experienced by Black women. Her commitment to equity is never overbearing or moralizing in a way that could put off someone who sees things differently. Rather, she's diplomatic, polite, and inclusive. Thank you, Heather. Now next is the award for accountability, and we're recognizing TJ Hadden, a financial manager with the Division of Finance and Administration. TJ is constantly looking for ways to help improve the user experience for those he supports. He works with OUs across the department, helping with budgeting, forecasting, and other planning and reporting duties. TJ gathers raw data, but can still distill that data in a way that provides insight for presentation. In one instance, TJ coordinated with OUs to gather department-wide data, analyze the information, and prepare a final summary. With every task, TJ works to understand how his end customer is going to interact with the material, document, or spreadsheet that he provides, and works to deliver something that can make the job easier. Congratulations, TJ. Now our award for support goes to Jed Cook, a unit supervisor with the Utah State Developmental Center. Jed is such an amazing supervisor in the way he gives guidance and shares expertise with compassion and energy to everyone around him. The Unit 1 team works amazingly well together due to his leadership. He encourages all to do their best, to have integrity, treat each other with dignity and respect, and to give our individuals the care that they deserve. Jed goes to bat for any of his employees or individuals when he sees there's a need and is able to express those needs to administration. His staff see him as one of the best role models at USDC. Thank you, Jed. The award for efficacy goes to Cory Ruward, a licensed clinical therapist with the Utah State Hospital. Cory is an incredibly valuable asset. He finds a way to connect with even the most difficult patients he's assigned to work with. He's the poster child for patience and persistence with both staff and patients. His patients feel respected, cared for, and attended to. He has edited the entire written competency curriculum for Forensic Unit 1 to make it more understandable and to increase its effectiveness. He also enhanced the presentations for the anger management and thinking errors groups to keep patients engaged and learning. With his extensive knowledge of state and federal systems, he navigates these systems to the benefit of his patients. He's a true advocate for his patients. Now, our first team award goes to the Early Hearing Detection and Intervention Team, a mouthful, in the Office of Children with Special Healthcare Needs in our Division of Family Health. Years before the pandemic, if we can remember back then, they were the first EHDI program in the nation to offer teleaudiology to offer timely diagnosis to infants who fail newborn hearing screening in rural and frontier areas. They now have 7 teleaudiology locations across the state, and they were the first in the nation to have a testing program for congenital cytomegalovirus, the leading viral cause of developmental disabilities and childhood hearing loss. In the first 10 years of this testing program, among 12,000 tested infants, 129 have received an early diagnosis of allowing for appropriate and timely interventions. In addition, the team recently received 2 national awards, EHDI Website of the Year and the National EHDI Excellence Award for making outstanding contributions to state and national EHDI programs. Congratulations. Our second team award goes to the Long-Term Care Survey section from the Division of Licensing and Background Checks. These surveyors provide oversight of Utah's 98 certified nursing homes. Since October 2022, they've cited 21 instances of non-compliance in nursing homes in which individuals had either experienced or were at imminent risk for serious injury, impairment, or death. Additionally, they cited 78 instances of non-compliance in which individuals were harmed by the action or inaction of caregivers. Despite the stress of their jobs, these surveyors are skillful in gathering information through observations, interviews, and record review. They manage conflict and set aside personal bias to ensure fair and objective compliance assessments. And above all, this group of professionals is compassionate about the quality of life and quality of care of the nearly 5,000 individuals residing in Utah's nursing homes. P.S. The one downside to this group is that they tease their manager incessantly. Congratulations again to our recipients. We look forward to your nominations for the Winter 2024 Heart of Excellence, which will be open February 14th to the 26th. Thank you.